Massive hemorrhage is the number one cause of preventable death from injury. However, if treated quickly, many bleeds are not generally life-threatening. Even severe bleeding can be controlled at the scene prior to any EMS arrival with a little know-how and basic equipment. Uncontrolled bleeding, however, is a medical emergency, and acting quickly can save lives. There are 3 types and 2 classes of bleeding, which all differ in triage and management. All types of bleeding can be potentially dangerous if not controlled. A good basic first aid kit should be able to deal with most varieties. Abrasions or small cuts will produce capillary bleeding. The blood wells up or trickles from these wounds. Capillary bleeds are generally not life-threatening, but when numerous, as in accidents from broken glass or shrapnel, or over a large area, as in the case of road rash, capillary bleeds can be quite challenging to manage. Venous bleeds are deeper cuts where a vein is damaged or severed. These are much more serious as blood will flow steadily from the wound. Without intervention, blood loss can be substantial. Direct pressure will stop a venous bleed in most cases, but this is an emergency and needs ER attention. Arterial bleeds are deeper cuts where an artery is damaged or severed. Blood will spurt out with each heartbeat, and there is a potential for a large volume of blood loss in a short period of time. This type of injury needs immediate pre-hospital care to stop the bleeding and immediate transport to the ER. External bleeding is easy to locate and attend to. There are many injuries, however, that can produce very serious bleeding within the body. There are nearly no pre-hospital options for care for these injuries, so quick activation of EMS is crucial. If any mechanism of internal bleeding exists or is suspected, transport to the hospital immediately. These mechanisms include head injuries that can cause brain bleeding, soft tissue damage of limbs or organ damage from falls, or crush injuries. Falls from ladders and equipment, vehicle ejections or rollovers, livestock-related injuries can all cause internal bleeding. If someone suffers a penetrating trauma, for example a piece of metal or glass, it is important that you do not remove any impaled object or remove someone from an object they are impaled on. Stabilize the object, control the bleeding, and transport to care. Call 911 if private transport is not comfortable or safe. Learning how to recognize life-threatening bleeding and act quickly can mean the difference between survival and tragedy for someone who has suffered a work-related injury, been in a car accident, or some other trauma. These same skills can be used to treat less urgent but still serious bleeding with a simple first aid kit and a little bit of knowledge. Most bleeding, even serious bleeding, can be controlled with direct pressure. Place gauze, a towel, or any absorbent material that you have over the wound and press firmly. If you are able to encircle the injury with both hands for more pressure, do so. If blood seeps through the bandage, do not remove it. Place more bandages on top and continue pressure. Your body has begun to form a clot that will be disrupted if you remove the gauze. If bleeding is not controlled after 10 minutes of direct pressure, a pressure dressing can be added. There are many commercial compression bandages available to carry in a first aid kit. A pressure bandage can be made from any stretchy material. Elastic bandages work well, as do strips of a t-shirt. Whatever is used should be wrapped as tightly as possible to control bleeding. If the injured party is alert and oriented, they can be transported to the hospital by private vehicle. If they are showing signs of shock, such as dizziness, pale clammy skin, or are disoriented, or if the injury prevents them from safely walking on their own, an ambulance should be called to transport them. Sit or lie them down, keep them warm and comfortable until EMS arrives. Even most arterial bleeds can be controlled by direct pressure or a compression bandage. Some wounds, however, are severe enough that require a tourniquet. A tourniquet applies pressure to a limb above the site of the injury to occlude or close off the major blood vessels, which stops the bleeding. It is easier to occlude the vessels by applying a tourniquet high and tight on the limb. The arm and leg have one bone in the upper portion versus 2 bones in the forearm and lower leg, making it more likely the vessel can be compressed in the upper portion of the limb against the larger bone. Place the tourniquet high on the limb as tight as possible and secure with the Velcro strap. Turn the windlass until bleeding stops. Secure the windlass in place, wrapping the excess Velcro over the top. Secure both in place using the small Velcro tab. Mark the time the tourniquet was applied on the tab or on the patient's forehead. Do not remove the tourniquet for any reason. Tourniquets should only be removed by a medical professional in the emergency department. Tourniquets should be used for any partial or complete amputation or any bleeding that cannot be controlled with direct pressure. Commercially made tourniquets are significantly more effective and safer than improvised tourniquets. Belts and ropes make ineffective substitutes and can often do additional tissue damage. CAT tourniquets are recommended due to their ease of use and reliability. Make sure to purchase a genuine CAT tourniquet from a reputable source that carries a manufacturer's serial number. There are many counterfeit options available that are inexpensive and great for practice, but are not recommended for your first aid kit. Practice with the cheap version until you can quickly and efficiently apply your tourniquet. Remember, you may have to do this under stress. The tourniquet you carry should be in new, unused condition, out of the plastic, and ready to go.